We often talk about accreditation and keeping yourself safe in operating room facilities, and people frequently ask, well, what is accreditation and how do I know I'm being safe? It's a great question. There are only a certain number of bodies that will accredit an operating room. Now, if you're going to have surgery in a hospital, all hospitals are governed by JCAHO. It's commonly known as the Joint Commission, and they come and do inspections and make sure that the hospitals are adhering to very strict guidelines that relate to lots of details like the size of the room, the flow of the room, having emergency equipment, having emergency medication, all sorts of regulations that make sure that when procedures are done in that room, it's being done safely. The office-based surgery centers like mine are frequently accredited by Quad A. Quad A is the body that I use in my operating room, and we have a lot of the same requirements. We have to have rooms of a certain size, you have to have scrub sink facilities, clean rooms, rooms to process instruments, have access to the same emergency equipment, emergency medications, and all the policies in place to make sure that if anything happens, you'll be able to take care of your patients. And you get inspected on a regular basis, sometimes as often as once a year, to make sure that you're in compliance with all of those rules. So Quad A accreditation is what you should be looking for if you're going to have surgery in an office-based operating room. In a hospital, you're safe because they're all accredited by JCAHO. So ask your surgeon if he or she is using their own operating room, is it accredited by Quad A?